Health Insurance Portability and Accountability Act of 1996. Training Module. HIPAA Awareness. The information provided in this online course is our interpretation of the Health Insurance Portability and Accountability Act and is intended for educational purposes only. For complete information and updates, please refer to the actual HIPAA laws located at http://www.hhs.gov. The individuals, owners, consultants, and any other parties involved in the creation and delivery of this online educational course and any supporting materials hereby explicitly disclaim any and all liability for any action, advice, or opinion that results from the use or application of this educational material outside of its intended purpose. By partaking in this course, all participants acknowledge and understand it is their obligation to abide by the current laws, regulations, and policies that regulate their specific industry and their specific state of residence, and should not rely on this training as a source of legal information or advice. The purpose of this self-study training module is to provide a platform for you to gain an in-depth understanding of the U.S. law known as HIPAA. It will also familiarize you with the background of HIPAA and how we got to where we are today. Other lessons will cover the analysis of the regulatory areas of the Department of Health and Human Services, HHS, standards for electronic transactions, privacy regulations, security regulations, implementation procedures. Let's get started. What is HIPAA? HIPAA is an acronym which stands for Health Insurance Portability and Accountability Act of 1996. Initially known as the Kennedy-Kassebaum Act, HIPAA, Public Law 104-191, was enacted on August 21, 1996. It amended the Internal Revenue Service Code of 1986. The Department of Health and Human Services, HHS, is the primary federal agency responsible for administering HIPAA. Congress passed the landmark HIPAA legislation to provide consumers with greater access to health care insurance, portability, protect the privacy and security of their health care data, and to promote more efficiency, bring standardization into the healthcare industry, accountability, improve the efficiency of healthcare systems. The healthcare industry actually set the foundation for HIPAA to be enacted. Healthcare industry demanded simplification of confusing processes in submitting electronic claims. Since no standardization existed among insurance companies and providers, hundreds of variations and formats were used for filing claims. Congress agreed with concept of standardization, but concerns grew regarding confidentiality of patients' information. So, privacy regulations for protected health information, PHI, were developed. HIPAA, more than privacy. HIPAA applies to more than just privacy of patient health information. The Act covers many topics unrelated to privacy. For example, insurance fraud and reform, pre-tax medical savings accounts. HIPAA is a very complex federal law involving many regulations that affects the entire healthcare system, from individuals to employers, health plans, healthcare providers, healthcare clearinghouses, and other entities providing health information services. The HIPAA regulations are structured as 5 major provisions or titles. Title I, Health Insurance Access, Portability, and Renewability, also known as Insurance Reform. Title II, Preventing Healthcare Fraud and Abuse, Administrative Simplification, Medical Liability Reform. Title III, Tax-Related Health Provisions. Title IV, Application and Enforcement of Group Health Plan Requirements. Title V, Revenue Offsets. Titles 1 and 2. Titles 1 and 2 affect most healthcare entities via insurance reform and enhanced standards for privacy, security, and electronic transactions. Insurance reform affects most insurance payers. Insurance reform primarily provides continuity and portability of insurance by guaranteeing insurance policy renewal, providing patients the right to keep insurance even after changing jobs, COBRA, prohibiting different forms of discrimination, preventing the use of pre-existing conditions to exclude new plan members. Insurance reform is not covered in this training lesson. Administrative simplification. The primary administrative simplification objectives: improve effectiveness in healthcare delivery by creating standardized electronic data interchange formats. Implement controls to protect an individual's health information, privacy, and security. Mandate safeguards to protect access, use, and disclosure of PHI and electronic PHI, ePHI. Enforce penalties for non-compliance of objectives. Administrative simplification rules definitions. Electronic transaction codes. Describes diagnosis and procedure codes, code sets, and updated standards for electronic healthcare and healthcare-related transactions. Privacy. Describes what types of individually identifiable health information, IIHI, is protected. Diagnosis, treatment, or service payments, and who is authorized to access, use, or release the information. Security describes how IIHI is safeguarded, ensuring privacy, confidentiality, integrity, and availability of PHI by controlling access and protecting it from inappropriate disclosure, accidental or intentional destruction or loss, as well as technical protection of a covered entity's networks and computers. Who must comply with HIPAA? The HIPAA law does not apply to every healthcare provider or to every individual's personal healthcare information, only covered entities. A covered entity is defined as either a healthcare provider, e.g., doctors, clinics, with limitations. Health plan, e.g., HMOs and company health plans. Healthcare clearinghouse, e.g., individuals or companies processing non-standard health information. A covered entity is also one that or who maintains protected health information in any form or format. This includes paper medical records, electronic medical records, and oral communications. One that or who transmits PHI information in connection with a standard transaction. A business associate, including third-party vendors, who perform services on behalf of different covered entities and share PHI. Note: a covered entity should always enter into a contract with a business associate. HIPAA. What information does it apply to? HIPAA applies to patient health information in paper or spoken form, electronic form, covered transactions. Examples include names, not just the patient's name, but names of employers or family members. Dates, date of birth, date of admission, date of service. Numbers, Social Security number, medical record number, device serial number. Address, anything smaller than a state, such as a city or street name. HIPAA, covered transactions. Requests of and payments for medical services or equivalent patient information. Transmittal information and healthcare claim status. Coordination of benefits. Enrollment and disenrollment in a health plan. eligibility for a health plan, health plan premium payments, referral certification and authorization. HIPAA, compliance dates, transactions, total compliance by October 16, 2002, or October 16, 2003, small health plans. Code sets, total compliance by October 16, 2002, or October 16, 2003, small health plans. Privacy, total compliance by April 14, 2003, or April 21, 2006, small health plans. Security, total compliance by April 21, 2005, or April 21, 2006, small health plans. As evident, the deadline for complete compliance has occurred. Unique identifiers. National Provider Identifier Standard. Full compliance by May 2007 or May 2008 for small health plans. National Employer Identifier Standard. Full compliance by July 2004 or August 2005 for small health plans. Small health plans are those with less than $5 million in revenue. New HIPAA penalties. Penalties increased for failure to adopt and comply with the HIPAA privacy and security rules. Penalties are based on a tiered structure according to the level of the violation. If unaware of the violation, $100 for each incident, up to a maximum of $25,000 per year per violator. If due to reasonable cause, but not willful neglect, $1,000 for each incident, up to $100,000. If due to willful neglect, but corrected, $10,000 for each violation, up to $250,000. If due to willful neglect and uncorrected, $50,000 each, up to $1.5 million. Implications of non-compliance. Financial penalties. Public exposure that could lead to loss of market share. Loss of accreditation, JCAHO, NCQA, etc. Increased capital costs associated with late compliance efforts. Damages for litigation. Imprisonment. HIPAA compliance is not a one-time implementation project. It is an ongoing responsibility which needs to be part of the corporate culture and business processes. Become compliant now. Policies and procedures. Create and implement PHI policies and procedures to comply with the privacy rule. Stay up to date on all required HIPAA policies and procedures, and implement required changes as necessary to comply with applicable laws. Ensure changes to privacy practices are stated in your privacy notice. Privacy Authority. Appoint personnel or a privacy official with responsibility for privacy policies and procedures. Appoint a person or an office location responsible for receiving complaints. Safeguards and management. Implement administrative, technical, and physical precautions to protect PHI privacy. Report or act on any PHI disclosure promptly. Workforce training. Provide training on PHI privacy to workers as appropriate to their job functions. Develop and apply a system of injunctions and penalties for workers who violate the CE's policies or the requirements of the privacy rule. Documentation time limits. Retain required HIPAA documentation for a minimum of 6 years from the date it was created or from the date it was last in effect, whichever date is later. Includes policies and procedures, workforce training provided, privacy notices, privacy rule complaints and resolution, business associates contracts, any other communication required by HIPAA to be in writing. Health Insurance Portability and Accountability Act of 1996. Training Module. Privacy Rule. Learning Objectives. The purpose of this self-study training module is to provide a framework for understanding the HIPAA privacy rule. Privacy equals confidentiality. After completing this module, you should understand the following privacy rule terms. Individually Identifiable Health Information, IIHI. Protected Health Information, PHI. Covered Entity, CE. Business Associates, BA. Let's get started. Definitions. Individually Identifiable Health Information, IIHI. Basically, it is information that can be used to identify an individual patient. The official definition in the regulations is as follows. IIHI is information that is a subset of health information, including demographic information collected from an individual and 1. Is created or received by a healthcare provider, health plan, employer, or healthcare clearinghouse, and 2. Relates to the past, present, or future physical or mental health or condition of an individual, the provision of healthcare to an individual, or the past, present, or future payment for the provision of healthcare to an individual, and A. That identifies the individual, or B. To which there is a reasonable basis to believe the information can be used to identify the individual. Protected Health Information, PHI, is the protection of IIHI by a covered entity, whether or not the information is available in electronic form. Common identifiers of PHI include names, social security numbers, addresses, birth dates. Covered Entity, CE, is defined as either a health plan, individual or group plan that provides or pays for medical care, healthcare clearinghouse, public or private company or firm that processes PHI received from a CE, or converts transactions from a non-standard format into a standard format for a CE. Healthcare provider, any person or organization who provides, invoices, or is paid for healthcare in the normal course of business. Healthcare providers are covered by the rule only if they transmit electronic health information in connection with a standard transaction. CEs are also entities that or who maintain protected health information in any form. This includes paper medical records, electronic medical records, and verbal communications. Entities that or who transmit PHI information in connection with a standard transaction. Business associates, including third-party vendors, who perform services on behalf of different covered entities and share PHI. What is the HIPAA privacy rule? The HIPAA Standards for Privacy of Individually Identifiable Health Information, better known simply as the Privacy Rule, was effective April 21, 2006. Applies to patient health information in all forms: written, electronic, spoken. Regulates how a CE uses and discloses IIHI and PHI. How the Privacy Rule standards came to be. HIPAA, Public Law 104-191, included administrative simplification provisions that required covered entities to adopt standards for electronic healthcare transactions. Because concerns grew over the privacy of healthcare transactions, Congress added HIPAA provisions that mandated privacy protections for IIHI. In response to the HIPAA mandate, the U.S. Department of Health and Human Services, HHS, published a final regulation in the form of Privacy Rule Standards. The Privacy Rule Standards provide more patient rights for individuals and enable them to understand and control how their health information is used and disclosed for different purposes. Allow the flow of health information when needed to enable and provide high-quality health care. Permit important uses of information to protect the public's general health without sacrificing the individual's privacy of care. The privacy rule standards are not meant to override stricter state laws. Example, if a state, e.g. Texas, requires that healthcare providers keep medical records for 7 years before discarding, but HIPAA requires only 6 years of records, the healthcare provider must follow the state law and retain all of the medical records for at least 7 years. Patient rights. Right to request access to and a copy of their PHI. Right to request amendments to their PHI. Right to receive from the CE a concisely written explanation of how their health information will be kept, used, and disclosed. Right to receive from CE an accounting of any and all disclosures of their PHI. Example, John was employed as the new manager of a local free clinic. During the next 3 months, he received many requests from patients to make corrections to or changes in their health records. John did not find any clinic documentation relating to written policies on how or if such changes could be made. Thus, he spent many hours changing the patient's health records. Question: what needs to be in place to help John quickly decide how to correct records and if the records should be changed in any way? Answer: the clinic must have a set of procedures and policies in place, which is available to the staff, thereby confirming privacy rule compliance, saving staff time, and ensuring that each request is handled in a similar way. Disclosure. Detailed authorizations are mandatory for every use, other than for treatment, payment, or healthcare operations. Whenever PHI is disclosed, it must be limited to only the minimum necessary to comply with the request. Specific requirements must be met for researchers and others accessing PHI. Civil and criminal sanctions will be enforced for improper use or improper disclosure of PHI. Privacy. Scenario 2. Example: Angie, a receptionist at XYZ Hospital, is contacted by a famous local newspaper reporter. The reporter asks Angie to review the records of a celebrity undergoing treatment in the hospital. Angie is aware that the celebrity has a very good relationship with the hospital and also with one of the hospital's board members. So, Angie simply copied the patient's records and faxed them to the reporter. After discovering that Angie was responsible for giving the information to the reporter, she was immediately terminated. Question: what should Angie have done? Answer: Angie should have told the reporter that the health information of the patient is confidential, and she could not release any information without an authorization from the patient. Privacy. Scenario 3. Example: during a regular visit to the cancer center, Joan, an RN, finds out that the son of her neighbor is being treated for throat cancer. She visits her neighbor at church services and asks her about the health of her son. Her neighbor did not have any knowledge that her son had a health condition. Question: what should Joan have done differently? Answer: Joan should not have revealed any information about the health condition of her neighbor's son. HIPAA protects PHI in any form, which includes paper medical records, electronic medical records, and also spoken communications. Even talking about a patient's health condition to a family member away from the place of service is a violation of that patient's rights if the patient has not given consent. Minimum necessary. A CE must employ reasonable policies or procedures that limit minimum necessary, how much PHI is requested, how it is used, and/or how it is disclosed. Policies and procedures must limit who has access to PHI within the CE and under what conditions. Privacy rule standards do not apply to disclosures between healthcare providers discussing treatment or options. De-identification of PHI. Covered entities have two options to use and/or disclose PHI. Obtain an authorization signed by the patient or patient's representative, identifying the non-routine use and/or disclosure. Or, de-identify the information by deleting not only the primary or obvious identifiers, i.e., the patient's name, address, date of birth, treating physician, but also of secondary identifiers through which a user could realize the patient's identity, e.g., patient's place of employment. Required administrative requirements. A privacy officer who is responsible for privacy maintenance within the CE organization. Written contracts with different business associates, which specifies that PHI must be safeguarded. Administrative, technical, and physical safeguards in place to protect against misuse and releases of information not permitted by the privacy rule. Policies and procedures for reporting health info, e.g., communicable diseases, to the Department of Health. Documentation showing compliance with the privacy rule. Training materials for staff and business associates. Privacy. Scenario 4. Example. An outside vendor was hired for the purpose of reformatting electronic transactions or claims sent to a health plan provider for processing. Question. What should the health plan provider do to ensure that all PHI received is protected? Answer. The health plan provider should have a signed, written business associate contract with all existing outside vendors, detailing requirements and safeguards that must be in place to ensure all patient information is protected. Privacy Notice Documents. Notice of Privacy Practices, NPP, is a document required for informing patients about their rights. NPP must be provided by each covered entity to every patient. NPP provides patients with written notice of the PHI access, use, and disclosure policies of the rule. All direct treatment providers must make an earnest effort to obtain a written response from the patient that the patient has received, read, and understands the different aspects of the NPP. Authorization documents. Authorization forms are required by the privacy rule and must be provided by each CE for uses and disclosures of PHI not otherwise permitted, e.g., non-health related uses, including marketing and clinical research. Authorization forms must provide details on how the patient's PHI will be accessed, used, and disclosed, who the authorized person will be to use or make the disclosure, to whom the CE may disclose PHI, the date for which the information may no longer be used or disclosed. The CE may not condition treatment on whether or not the individual provides PHI authorization. Consent after PHI release. In an emergency, the healthcare provider must attempt to obtain consent after treatment as soon as it is reasonable to do so. Privacy. Scenario 5. Example. A family doctor wishes to refer a patient to a specialist for an injury caused by an auto accident. Question. Does the family doctor require an authorization from the patient to discuss this injury? To discuss this injury, the circumstances of it, and the past medical history of the patient? Answer. No. Patient authorization is not required because referrals are part of the treatment under the privacy rule. Therefore, authorization is not required. Privacy. Scenario 6. Example. Rosa, a senior airline pilot, was placed on probation after management learned she was on anti-anxiety medication. Rosa soon discovered that her pharmacy had released the information related to the medicines she was taking. Question: is the pharmacy subject to the privacy rule? Answer: yes. All information related to Rosa's medication is considered PHI and should never have been disclosed. Exceptions that allow PHI disclosure. Covered entities may disclose or use PHI in the following circumstances: public health activities, e.g., collect or receive information for preventing or controlling diseases, injuries, vital statistics, such as births, marriages, deaths, interventions, emergencies involving health or safety of the individual or the public, when required by law or as per a judicial order in legal proceedings, e.g., child abuse, when subpoenaed by law enforcement, e.g., criminal investigations,
What the fuck?
as required for healthcare oversight activities, federal or state agencies that oversee the CE's activities, specialized government functions, organ transplants or procurement organizations, claims which are related to workers' compensation, PHI to medical examiners, coroners, and funeral home directors, incidental disclosures and use. Incidental use and disclosures. An incidental use or disclosure is a secondary use or disclosure that cannot reasonably be prevented, is limited in nature, and that occurs as a result of another use or disclosure that is permitted by the rule. It is not expected that a CE's safeguards will guarantee the privacy of PHI from all potential risks. Examples of incidental disclosures include the following occurrences: sign-in sheets, e.g., waiting rooms, patient charts at a hospital bedside, doctors talking with patients in semi-private rooms, doctors quietly conferring at nurses' stations with the potential of being overheard by a passerby. HIPAA penalties. Penalties for failure to adopt and comply with the HIPAA privacy rule are based on a tiered structure according to the level of the violation. If unaware of the violation, $100 for each incident up to a maximum of $25,000 per year per violator. If due to reasonable cause but not willful neglect, $1,000 for each incident up to $100,000. If due to willful neglect but corrected, $10,000 for each violation up to $250,000. If due to willful neglect and uncorrected, $50,000 each up to $1.5 million. Privacy rule violations. The only sure way to be safe is to not access patient records unless you need to as part of a specific job task. Only access the information that is necessary for you to see. Get permission or authorization from the patient before sharing any PHI. Follow the HIPAA guidelines and rules. Protect the patient and yourself. Other privacy safeguards. Avoid conversations involving PHI in public or common areas, such as hallways or elevators. Keep documents containing PHI in locked cabinets or locked rooms when not in use. During work hours, place written materials in secure areas that are not in view or easily accessed by unauthorized persons. Do not leave materials containing PHI on desks or counters, on fax machines, in conference rooms, or in public areas. Do not remove PHI in any form from the designated work site, e.g., via laptops, portable drives, unless authorized to do so by management. Never take photographs in patient care areas. HIPAA Privacy Rule Summary. HIPAA Privacy Rule mandates privacy protection of individually identifiable health information, IIHI, when held by a covered entity, CE, regardless of whether the information is used in an electronic format, except in limited circumstances. The Privacy Rule standards and administrative requirements grant patients the right to see, control, and receive a copy of their health information. The Privacy Rule allows for health information disclosure exceptions, e.g., research, law enforcement, and incidental use. In conclusion, ask yourself, am I willing to risk prison and/or a financial penalty, losing my job, being dismissed from a professional school program because I didn't follow the legal, ethical, and right thing to do? Health Insurance Portability and Accountability Act of 1996. Training Module. Security Rule. Learning Objectives. The purpose of this self-study training module is to broaden your understanding of the HIPAA Security Rule. After completing this module, you should be more familiar with the following security rule terms: individually identifiable health information, IIHI, electronic protected health information, EPHI, covered entity, CE, administrative, technical, and physical safeguards, implementation specifications. We'll start by reviewing what we learned in HIPAA awareness. The security rule applies to the following person or organization, covered entity, who, in the normal course of business, transmits health information electronically. Health plan, individual or group plan that provides or pays for medical care. Healthcare clearinghouse, public or private company or firm that processes PHI received from a CE or converts transactions from a non-standard format into a standard format for a CE. Healthcare provider, any person or organization who provides, invoices, or is paid for healthcare. The security rule also applies to business associates, third-party vendors, others who perform data transmission services on behalf of different CEs. HHS is the acronym for the U.S. Department of Health and Human Services, which is the United States government's principal agency for protecting the health of all Americans and for providing essential human services. What is the HIPAA Security Rule? HIPAA, Public Law 104-191, includes an administrative simplification provision that requires the HHS to adopt standards to protect the privacy and security of IIHI electronic healthcare transactions. The security standards for the protection of electronic protected health information, better known simply as the Security Rule, became effective April 20, 2006. What are the Security Rule standards? In a nutshell, the Security Rule standards mandate that CEs must safeguard individuals' health information that is created, held, or transferred in electronic form, EPHI. The Security Rule does not apply to personal health information transmitted orally or in writing, paper-to-paper faxes, or voicemail messages. Why the need for security standards? More healthcare providers are using software applications, for example, physician order entry systems, pharmacy, radiology, and laboratory systems, electronic health records. More health plans are providing electronic access to care management, claims, member self-service applications. As a result, Congress wanted to protect the privacy of IIHI while still permitting CEs the flexibility to adopt new technologies to improve quality and efficiency of patient care. As CEs adopt new e-technologies, the security rule stipulates administrative, technical, and physical security safeguards for CEs to use that protects accessibility, ensures confidentiality, ensures integrity of the EPHI. HIPAA Security Rule. The breakout of the security standards is very confusing to most people, but we'll try to simplify the explanation as much as possible. With that in mind, first of all, there are 18 standards, which are categorized into 3 groups of safeguards. 1. Administrative safeguards includes 9 standards. 2. Physical safeguards includes 4 standards. 3. Technical safeguards includes 5 standards. The following slide describes the official regulations of each group of safeguards. Security Rule Standards. Administrative safeguards are administrative actions and policies and procedures to manage the selection, development, implementation, and maintenance of security measures to protect EPHI and to manage the conduct of the CE's workforce in relation to the protection of that information. Physical safeguards are physical measures, policies, and procedures to protect a CE's electronic information systems and related buildings and equipment from natural and environmental hazards and unauthorized intrusion. Technical safeguards are the technology and the policy and procedures for its use that protect EPHI and control access to it. The next section will outline and explain each of the security safeguards. Administrative safeguards for EPHI. Require documented policies and procedures for addressing various security issues regarding the CE's daily operations, managing the conduct of employees regarding EPHI, directing the choice, progress, and use of security controls. Documentation must be made available to the individuals who are responsible for implementing the related procedures. Administrative safeguards include 1. Security management process. 2. Assigned security personnel. 3. Workforce security. 4. Information access management. 5. Security awareness and training. 6. Security incident procedures. 7. Contingency plan. 8. Evaluation. 9. Business associate contracts and other arrangements. Physical safeguards for EPHI. Physical safeguards refer to controlling physical access to EPHI stored on computers and/or electronic devices to only authorized individuals. Physical safeguards include 1. Facility access controls. 2. Workstation use. 3. Workstation security. 4. Device and media controls. Technical safeguards for EPHI. Technical safeguards detail how various technologies should be used to protect and control EPHI, but do not specify requirements for types of technology to use. The minimum standard, or the least that a CI must do to protect EPHI, is defined, but a CE may choose to do more. Such a decision should be made from the required individual risk analysis and vulnerability assessment. The security rule requires a CE to document this process. While general threats to EPHI are known, each CE's own vulnerability results will determine the risk specific to that entity. Technical safeguards for EPHI include 1. Access controls. 2. Audit controls. 3. Data integrity. 4. Person or entity authentication. 5. Transmission security. Examples of technical safeguards: user IDs and passwords, encryption. Reminder: the HIPAA security rule includes 18 security standards. Administrative safeguards has 9 standards. Physical safeguards has 4 standards. Technical safeguards has 5 standards. Next, the government makes it more complex. Of the 18 security rule standards, 12 standards have implementation specifications. There is a total of 36 implementation specifications among these 12 standards. Standards versus specifications. Reminder: standards explain what a CE must do. Specifications explain how to do it. The 36 implementation specifications are further classified as either required or addressable. 14 specifications are required. R. The CE must comply with the implementation. 22 specifications are addressable. A. Addressable does not mean optional. Addressable specifications permit CEs to determine whether the addressable specification is reasonable and appropriate for them to implement. Define the process that CEs must follow to make that decision. The determination process will depend on factors such as CE's risk analysis, CE's risk mitigation strategy, CE's existing security measures, CE's size and resources, CE's cost of implementing the specification. If the specification is reasonable and appropriate, the CE must comply as stated, or implement an alternative security solution to accomplish the intent of the standard, or not implement the specification or any alternative if the specification is not reasonable and/or appropriate for the CE's workplace, but the CE must document the assessments and decisions. This chart summarizes the flow of the security rule requirements. Security rule standards, 18. Safeguards, 3 groups. Administrative, 9 standards. Physical, 4 standards. Technical, 5 standards. Implementation specifications, 36. Required, 14. Addressable, 22. Administrative safeguards and implementation specifications. Standards. Security management process. Implementation specifications. Risk analysis. Required. Risk management. Required. Sanction policy. Required. Information system activity review. Required. Assigned security responsibility. Required. Workforce security. Authorization and/or supervision. Addressable. Workforce clearance procedure. Addressable. Termination procedures. Addressable. Information access management. Isolating healthcare clearinghouse function. Required. Access authorization. Addressable. Access establishment and modification. Addressable. Security awareness and training. Security reminders. Addressable. Protection from malicious software. Addressable. Login monitoring. Addressable. Password management. Addressable. Security incident procedures. Response and reporting. Required. Contingency plan. Data backup plan. Required. Disaster recovery plan. Required. Emergency mode operation plan. Required. Testing and revision procedure. Addressable. Applications and data criticality analysis. Addressable. Evaluation. Required. Business associate contracts and other arrangements. Written contract or other arrangements. Required. Facility access controls. Contingency operations. Addressable. Facility security plan. Addressable. Access control and validation procedures. Addressable. Maintenance records. Addressable. Workstation use. Required. Workstation security. Required. Device and media controls. Disposal. Required. Media reuse. Required. Accountability. Addressable. Data backup and storage. Addressable. Access control. Unique user identification. Required. Emergency access procedure. Required. Automatic log-off. Addressable. Encryption and decryption. Addressable. Audit controls. Required. Integrity. Mechanism to authenticate ePHI. Addressable. Person or entity authentication. Required. Transmission security. Integrity controls. Addressable. Encryption. Addressable. Security breach incidents. The covered entity must develop procedures and policies to identify security incidents and respond based on established protocols. Apply sanctions against workers who fail to comply with CE security policies and procedures. Ensure that access privileges are terminated with termination of employment. Document all the security incidents and various outcomes. Security contingency plans. The covered entity must provide data backup and data recovery plans. Establish and implement procedures for making exact copies of ePHI for restoration of data loss due to any catastrophe. Test and revise procedures for the continuation of critical business processes while protecting the security of ePHI when operating in emergency mode. Documentation. CE is required to maintain all documentation on its policies, procedures, and decisions for 6 years from the date it was created or last day it is in effect. CE must, on a regular schedule, review all its documentation related to security and revise or update it as needed to ensure ePHI confidentiality, integrity, and availability. CE might incur no security rule penalties for implementation decisions later found non-compliant, as long as documentation is proper and available. Security training. CEs must regularly train employees. Training should become part of a CE's new employee orientation program, part of a demonstration of annual skills, JCAHO preparation, or other professional proficiency, part of all state certification processes. Example: the staff and volunteers of HIPAA Hospital were being trained on its hospital network computer system, using the same username and password to access the system. Since the system contained ePHI, once training was completed, they were told, every individual would need to have a unique username and password. Question: is the information correct? Answer: yes, as the access control standard states. Every employee needs to be assigned a unique name and/or a number for the purpose of identifying and tracking electronic access and transmissions. Example: Big Medical Health Plan has initiated facility policy access controls, which requires that all visitors must sign in, wear a specific visitor's badge, and then be escorted by an employee during their visit. Question: Has the health plan done enough to satisfy the security rule standard for visitors to its building? Answer: yes. The health plan has in place different procedures and policies, which would alert managers to watch for individuals in locations where EPHI might be accessed. Example: when it was break time, Carol, a medical records clerk at the local hospital, took her break as scheduled and stepped away from her workstation. During Carol's absence, Deborah from Guest Services was passing through the area and saw her pastor's name on Carol's monitor and found out he was being treated for cancer. Question: what should Carol do before leaving her workstation? Answer: all workstation monitors are required to be turned off before the employees leave the area and have screensavers that require a password to log in again. All computers must have a timed automatic off to prevent unauthorized access to EPHI. Non-compliance risks. Financial penalties. See next slide. Litigation. Increased cost of coverage. Imprisonment. Higher capital costs which are associated with forced compliance. Random audits. Non-compliance penalties. Penalties for failure to adopt and comply with the HIPAA security rule are based on a tiered structure according to the level of the violation. If unaware of the violation, $100 for each incident up to a maximum of $25,000 per year per violator. If due to reasonable cause but not willful neglect, $1,000 for each incident up to $100,000. If due to willful neglect but corrected, $10,000 for each violation up to $250,000. If due to willful neglect and uncorrected, $50,000 each up to $1.5 million. HIPAA Security Rule Summary. Steps for complying with the security rule. Assess current security, risks, and gaps. Determine security measures. Develop an implementation plan. Document decisions. Reassess periodically. HIPAA security. What can you do? Report violations, incidents, and bad practices to your clinical manager or someone in charge. Exercise good professional judgment and seek expert advice. Remind others of privacy and security responsibilities. Take HIPAA security seriously. HIPAA security checklist. Sample. 1. Appoint a designated person as your organization's security officer. 2. Compile a HIPAA security team with representatives of all applicable departments, e.g., legal, human resources, information systems, medical records, facilities, etc. 3. Establish a meeting schedule for the security team. 4. Review the HIPAA security rule standards and specifications. 5. Create a security game plan. 6. Complete a security risk assessment and inventory of all information systems and EPHI workflow processes. 7. Review vulnerability assessment risks and gaps. 8. Compare your current billing forms to the HIPAA electronic claims transaction and code set regulations. 9. Compile a list of business associates, TPAs, third-party administrators, and vendors. Policies and procedures. 10. Create and implement policies and procedures to prevent, detect, contain, and correct security violations. 11. Create sanction policy. Apply appropriate sanctions against workforce members who fail to comply with the security policies and procedures of the covered entity. 12. Create contingency and data backup plans. Health Insurance Portability and Accountability Act of 1996. Training Module. Implementation Specifications. Learning objectives. The purpose of this self-study training module is to provide a framework for understanding the specifications for implementing the HIPAA standards. After completing this module, you should understand the following categories: compliance dates, standards for electronic transactions, privacy rule, security rule. Compliance dates. A HIPAA compliance date is the date on which a covered entity, CE, must meet the requirements of a standard, safeguard, implementation specification, or modification. All compliance dates for initial HIPAA laws have passed. For example, May 23, 2008 was the compliance date for large and small health plans. Standards for electronic transactions. Develop a plan of action for compliance with each rule. Assess current use of electronic transactions. Integrate and utilize standardized transaction formats for the following: health plan eligibility, health plan premiums, enrollment and unenrollment, coordination of benefits and related electronic transactions, health claims, first injury reports, payments for healthcare claims and claim status. Integrate and utilize standard code sets. Integrate and utilize standard unique identifiers. Standards for privacy rule. Develop a plan of action for compliance with each rule. Assign a privacy officer. This individual is responsible for privacy within their organization. Develop and implement policies, procedures, and systems to protect individual health information and rights. Ensure written contracts with business associates are in place, confirming PHI will be safeguarded. Provide organization-wide education and training. Provide ongoing training for staff and agents with access to PHI and ePHI. Patient rights. Ensure patients have the right to request access to inspect and receive a copy of their health records, excluding psychotherapy notes. Request corrections to their health information. Request an accounting of any disclosure of their PHI. Request restrictions on the use and specific disclosure of their PHI. Ensure patients receive the following documents: Notice of Privacy Practices. This document informs patients of their rights and provides them with adequate written notice of the PHI use and disclosure policies of the CE. Authorizations. Patients must provide their signed permission before a CE can use or disclose PHI for non-healthcare related uses, such as marketing, clinical research, etc. Required security rule standards. Security management process. Risk analysis, risk management, sanction policy, information system activity review. Appointment of workforce security responsibility. Information access management. Security awareness and training. Security incident procedures. Evaluation. Business associate contracts. Required administrative safeguards. The administrative safeguards include organizational policies and procedures to address security issues regarding the CE's workforce. The CE must document all policies and procedures and update them on a regular basis. Required technical safeguards. Develop measures, policies, procedures, and documentation for unique user identification. Assign unique name and/or number for identifying and tracking user identity. Emergency access procedure. Establish and implement procedures for obtaining necessary ePHI during an emergency. Automatic log-off. Implement procedures that terminate an electronic session after a predetermined time period or of inactivity. Encryption and decryption. Implement mechanism to ensure ePHI cannot easily be intercepted and interpreted by anyone other than intended recipient. Audit controls. Establish mechanisms that record and examine certain activities in computer systems that contain or use ePHI, hardware, software. Person or entity authentication. Verify that a person or entity seeking access to electronic PHI is the one permitted for that access. Required physical safeguards. Develop measures, policies, procedures, and documentation for facilities access control. Facility security plan. Limit physical access to any information systems and the location in the facility in which they are housed, while ensuring that authorized access is allowed. Access control and validation. Validate a person's physical access to facilities based on their job or function, including access control to software programs for tests and updates. Maintenance records. Document repairs and modifications to any physical structure of a facility. Device and media controls. Disposal. Address the final removal of electronic PHI and/or hardware on which it is stored. Media reuse. Remove ePHI from electronic media before it is made available for reuse. Accountability. Maintain a record of hardware and electronic media locations and the personnel who are responsible for them. Data backup and storage. Create retrievable, exact copies of ePHI before equipment is moved. HIPAA Privacy and Security Rules Summary. HIPAA Privacy and Security Rules mandates privacy protection of individually identifiable health information, IIHI, when held by a covered entity, except in limited circumstances. The standards and administrative requirements grant patients a right to see, control, and receive a copy of their health information. All CEs must train its employees on the privacy and security rule standards and specifications. Always assess current risks, vulnerabilities, and gaps. Document all processes, procedures, and decisions. Health Insurance Portability and Accountability Act of 1996. Updates, 2012. Training Module. HIPAA, ERA, High-Tech. The purpose of this online training module is to provide an update of the U.S. laws governing protected health information. After completing this module, you should understand the following terms: ERA, High-Tech, HIPAA updates. Let's get started. HIPAA, Health Insurance Portability and Accountability Act of 1996. ERA, Federal Economic Stimulus Bill, the American Recovery and Reinvestment Act of 2009. High-Tech, Health Information Technology for Economic and Clinical Health Act. Updates contained in Title 13 of the ERA Stimulus Bill. HHS, Department of Health and Human Services. EHR, Electronic Health Record, electronic version of patient's medical history, maintained by the healthcare provider in the course of care services, may include clinical data, including demographics, medications, reason for visits, immunizations, and lab and radiology reports. PHI, Protected Health Information. ePHI, the electronic version of protected health information. Covered entities, CEs. 1. Health plan. 2. Healthcare clearinghouse. Or 3. healthcare provider who transmits any health information in electronic form in connection with a transaction covered by high-tech. Business associates. On behalf of a covered entity, a person who performs, assists, or provides legal, actuarial, accounting, consulting, data aggregation, management, administrative, accreditation, or financial services to or for the covered entity that involves the disclosure of individually identifiable health information. Security. Safeguards for the storage, access, and transmission of an individual's protected health information. Privacy. Limits the use or disclosure of PHI and also gives individuals the right to see and get copies of their health records, request amendments to their records, and learn details of certain disclosures of their records. ERA. ERA refers to the American Recovery and Reinvestment Act of 2009, Public Law 111-5. ERA is better known as the Economic Stimulus Bill. Many of the ERA provisions are geared toward individuals, e.g., homebuyer credit, health coverage tax credit, home energy efficiency incentives. But within ERA, there are many different stimulus opportunities, one of which is $19.2 billion for health information technology, IT, Title 13. Title 13 of ERA. Title 13 of ERA was given a subtitle, Health Information Technology for Economic and Clinical Health, High Tech. It is this section that deals with many of the health information communication and technology provisions, including Subpart D, Privacy. High Tech Act. The High Tech Act contains additional requirements that modify HIPAA in important ways. For example, financial incentives for EHR adoption under Medicare and Medicaid, marketing communications, accounting, additional restrictions. But we will not be covering them in this training. Subtitle D, Privacy. The following slides present a brief summary of Subtitle D, Privacy. A significant part of high tech directly pertains to privacy and security associated with the electronic transmission of PHI, ePHI. The intent of Subtitle D, Privacy, is to bring clarification to HIPAA privacy and security rules, with new requirements and changes that impact CEs and the business associates of CEs. Subtitle D's principal section is Part 1, Improved Privacy Provisions and Security Provisions. Included in Part 1 are provisions that expand HIPAA privacy and security rules, initiate various changes that will directly impact ePHI and the use and management of EHR, affect all healthcare providers, hospitals, and third-party service providers that either maintain or require access to an individual's medical information. What has high-tech changed? This graph displays the high-tech changes to the original HIPAA regulations. Enhanced privacy and security, business associate liability, breach notification, audit programs, enforcement actions. The High-Tech Act applies enhanced privacy and security regulations, additional liability regulations that apply to business associates in the same manner as they apply to a CE, new breach notification requirements, new rules for the accounting of disclosures of ePHI, stronger enforcement actions. Covered entities, effective January 1st, 2011 and January 1st, 2014. CEs must agree to patients' PHI disclosure restriction requests, which was originally an option. CEs must educate the patient that there are exceptions that exist regarding disclosures to health plans and payments. Business associates, described as but not limited to, person or organization other than a member of the CE's workforce who performs certain functions or activities on behalf of CE, or provides certain services to a CE that involves the use or disclosure of individual identifiable health information, IIHI. Business associates, subject to same HIPAA regulations as CEs in the following areas: must comply with HIPAA administrative, technical, and physical safeguards, must establish and maintain appropriate HIPAA policies and procedures, must document all security rule compliance activities, must report breaches, will be responsible for same civil and criminal penalties. Business associates, contracts with CE to include all new high-tech requirements, restricted from EPHI uses and disclosures not in compliance with business associates contract. Additions to business associates category: personal health record vendors, health information exchanges, third-party vendors and organizations, covered entities and business associates, prohibited from receiving payment for PHI unless authorized by the patient. Note: patient is to mean individual or patient's representative, if patient is a child or vulnerable adult. Must notify each patient who is affected by a breach notification, when their PHI is accessed, acquired, or disclosed because of the breach. Adhere to patient's restriction on disclosures to health plans of their health information related to privately paid services. The following slides outline changes that are now in effect, unless noted. On November 30th, 2009, the regulations associated with the HIPAA-era high-tech enhancements became enforceable. Personal health records and electronic health records. PHR is an electronic record of a patient's health information by which the patient controls access to the information, has the ability to manage, track, and participate in his or her own health care. EHR is an electronic health record of a patient's health information that is held and maintained by a healthcare provider and may contain all the information that once existed in the patient's paper medical record. EHR, Accounting of Disclosures. Effective January 1st, 2011 and January 1st, 2014. U.S. Department of Health and Human Services must adopt and publish standards within 6 months from enactment. Accounting of disclosures. Include disclosures of treatment, payment, and operations. Must be made if requested, and must include 3 years of medical records history. May include a reasonable fee for the accounting, passed on to the patient. However, it cannot be greater than the direct labor cost to provide the accounting. EHR, Patient Rights. Effective January 1st, 2011 and January 1st, 2014. When EHR are used, patients have right to electronic copy of their records. Patient can instruct CE to send electronic copy directly to another entity. Fees are limited to the direct labor costs with fulfilling any request. HIPAA regulations. Breach notifications. Who must notify patients of any breach? Covered entities, business associates, personal health record vendors. HIPAA regulations. When and how of breach notifications. When unsecured EPHI was accessed, acquired, or disclosed in a breach. Notifications to patient must be sent without reasonable delay, no later than 60 days after breach. To be sent first-class mail, unless specifically stated by patient that information can be emailed. Content of notifications are subject to HHS regulations. Unsecured ePHI is essentially any unencrypted data, including all physical media. If 10 or more victims can't be located, notice on website or in media must be posted. Breaches involving greater than 500 victims. Mandatory and immediate reporting to HHS. Breaches involving less than 500 victims. CE keeps log, provides to HHS annually. If more than 500 victims, HHS will publicly post on Internet. New marketing and fundraising restrictions. Recipients of marketing materials or fundraising information must have a clear definition of marketing. Must have a clear and conspicuous way to opt out of future communications. Opt-out is understood as a revocation of authorization to marketing communication. Selling of personal health information. No selling of PHI. Change to HIPAA privacy rule, previously allowed for some uses. No payment for PHI will be received by a CE, even if disclosure is permitted, without an authorization from patient that includes permission to sell. Exceptions exist for research, public health activities, sale or transfer of practice. Limited datasets and de-identified data. Limited datasets, LDS. Preferred over minimum necessary disclosures. Provides clearer, simpler, uniform approach to de-identifying data for uses and disclosures not involving treatment or payments. Minimum necessary definition. Effective 18 months after enactment. New guidance from HHS. New guidelines will clarify definition between minimum necessary and limited datasets. Give definition of practical use of minimum necessary and limited datasets. Clarify extent of requests for PHI by one CE to another CE treating same patient. Note: no CE or business associate will be held to new standards until new guidelines are issued by the HHS. New HIPAA penalties. Penalties increased for failure to adopt and apply the HIPAA privacy and security rules. Penalties are based on a tiered structure according to the level of the violation. If unaware of the violation, $100 for each incident, up to a maximum of $25,000 per year per violator. If due to reasonable cause, but not willful neglect, $1,000 for each incident, up to $100,000. If due to willful neglect, but corrected, $10,000 for each violation, up to $250,000. If due to willful neglect and uncorrected, $50,000 for each violation, up to $1.5 million. Important compliance dates: HIPAA and HITECH. 2012, February 17th. Establishment of regulations for methodology for providing individuals with the percentage of HIPAA penalties collected. 2013. Newer systems give an extended deadline to comply with new accounting for disclosure rules. 2014, January 1st. Original deadline for older systems to comply with new accounting for disclosure rules. 2014, February 17th. Study on impact of ERA by Government Accounting Office. By 2016, extended deadline for older IT systems for compliance of accounting of disclosure rules. ERA and HITECH Act updates. September 12, 2011. HHS announces proposed rule for direct patient access to clinical lab results. It would allow patients to gain access to test results and reports directly from labs instead of waiting to get them from their physicians. When patients have their lab results, they are more likely to ask the right questions make better decisions, and receive better care. HHS Secretary Kathleen Sebelius. The Notice of Proposed Rulemaking, NPRM, proposes to amend the Clinical Laboratory Improvement Amendments of 1988, CLIA, regulations, and HIPAA privacy regulations to strengthen patients' right to access their own laboratory test result reports. September 12, 2011. HHS announces Voluntary Personal Health Record, PHR, Model Privacy Notice. An easy-to-read, standardized template allowing consumers to compare and make informed decisions based on their privacy and security policies and data practices about PHR products. New template is similar to the nutrition facts labels in that it presents certain complex information in a simple way. October 1st, 2011. HHS announces new health IT website. The new website, www.healthit.gov, creates dedicated consumer-oriented information that describes the benefits of health IT, provides consumer health education materials, and offers a valuable resource for learning about new advances in health IT. November 9th, 2011. High-tech audits begin. HHS Office for Civil Rights begins HIPAA audits to assess CE's compliance with the privacy, security, and breach notification rules. Results of the audits will be documented on HHS's website. November 30th, 2011. HHS announces changes to the timeline for meaningful use of Certified Electronic Health Records, EHR. Policy changes are designed to make it easier for CEs to qualify for incentive payments as they adopt, implement, upgrade, or demonstrate use of certified EHR technology. Under ERA, CEs who demonstrate meaningful use of certified EHR can qualify for Medicaid and Medicare incentive payments of $44,000 through Medicare or $63,750 through Medicaid, per eligible health care professional. To encourage greater participation in the program, HHS said that CEs who meet Stage 1 requirements in 2011 would not need to meet the Stage 2 standards until 2014. ERA and High-Tech Act. Updates. March 24, 2012. HIPAA/High-Tech Omnibus Rule. The Omnibus Rule is due to be released within 120 days, which is expected to clarify business associate liability, new restrictions on marketing and fundraising, data breach enforcement and penalties, among others. A final regulation on the high-tech changes to the HIPAA accounting of disclosure requirements is also expected, although it is unclear whether it will be released as part of the high-tech Omnibus Rule. July 3, 2012. OCR establishes requirements for HIPAA performance audits. The High-Tech Act amended HIPAA and requires the Office for Civil Rights, OCR, to perform periodic audits of CEs and business associates to ensure compliance with the HIPAA privacy and security rules and breach notification standards. The new comprehensive audit protocol is organized around modules representing separate elements of privacy, security, and breach notification. The protocol addresses 165 performance criteria. 77 of these focus exclusively on compliance of the security rule, and 88 in combination that deal with requirements of the breach notification and privacy rule. The new protocol updates the one used during the pilot program. August 3, 2012. HIPAA breaches continue to compromise. HHS reports nearly 20,970,222 individuals have been affected by large, more than 500 patients, health data breaches since the public reporting of such incidents began in September 2009. The average number of individuals affected by a large data breach is 43,963, and the median number of affected individuals is 2,184. About 21% of the large health data breaches reported to OCR involved a business associate of a CE. 54% involved theft. 20% involved unauthorized data access or disclosure. 11% involved loss of data. 6% involved hacking. 5% involved improper disposal of data, and 4% were labeled as other or unknown incidents. August 14, 2012. New guidance for HIPAA breach response plan. The National Institute of Standards and Technology, NIST, just released a new draft version of its Computer Security Incident Handling Guide. While NIST does not have full force of the law for non-federal agencies, the organization's documents are still looked at as an important security source, and the organization's guidelines show clear regard by the HHS. HIPAA privacy and security officers should take note and review it carefully.
we had homework. We and 7 other people didn't know we had